when you have to deal with a family member, and you kind of feel like you want to let that family member go a little bit. How long do you wait before you put your foot down and tell that family member, okay, now you're in my space?
Well, I've been blessed with very good PR skills.
Okay.
Um, and a lot of times, what I have learned with the family members over the course of many years doing this,
Mm-hmm.
they're frustrated and they just want answers. So I'm not a kid,
Mm-hmm.
and I work with a lot of nurses. I'm old enough to be their mother. So then I walk in, they look at me as, so, oh, good, we have an older person. It's not personal, but I have an older person here. I don't have some kid. This is somebody I can just lay it all out on the line. And that's what ends up happening to me. So then I have learned, yeah, I have a face that I do, and I just nod my head and I just listen. And then I let them, whatever the case may be, because it could be anything. But by the end of the day, we are best friends,
Oh,
and
okay.
that's only because they wanted to listen.
It's a good way to help defuse a situation, I suppose.
Yep, yep. I just nod my head, and I'm so sorry. I understand. I'm going to do the very best I can to make things better. I will find out this information you're seeking. It just I
So
and then I follow through with it, of course.
you'll go that extra mile to make sure that
Yeah.
person gets the answers they're looking for. And that frustration you were talking about, that's a big driver for uh, people to get heated on, and
Mm-hmm.
I've seen it many times, where somebody just had a few questions and they didn't have someone around who wanted to answer those questions.
Right. Mm-hmm.
Now, uh, the the work you're doing now, is that the only place you've ever worked in the healthcare field, or did you come
Oh,
from a
right. I came
previous?
from geriatric.
Ah,
Yeah, I
okay,
came from geriatrics. Yeah, my first job was at Jackson County Nursing Home in Murfreesboro.
okay. I was
Yeah.
gonna say I
Mm-hmm.
wasn't sure if you were one of those nursing home nurses, or
Yeah.
and so you've dealt with a gambit of different kinds of people as well.
Mm-hmm. Mm-hmm.
Okay.
I just wanted to expand my scope, my
Mhm.
learning scope, and that's why I went to the hospital setting.
Okay,
So,
gotcha.
mm-hmm.
And it sounds like you absolutely like the hospital setting. Probably a lot better than the nursing home setting. Probably keeps you going a lot more. As in busy, and then next thing you know, your day is over.
I don't like to. I don't like downtime. I'm not a sitter. I'm not. I sit to chart, and I absolutely hate charting.
Downtime will
I
make
would
a day
rather,
drag.
yeah, I would rather go do baths than sit and chart.
Okay, that's
So,
fantastic. Like,
hmm
so, uh, can you give us any ideas about some of the people that you've had to work with? Some of the, well, we'll just say, some of the injuries or um, uh, just something that blew your mind.
as far as employees,
uh, Whether it be employees or clients themselves, without going too far into it, we still want to respect HIPAA and blah blah blah.
well, they've it's um safety has come a long way in the last 15 years. And new inventions for safety. Um, Now we have, like, for instance, I've seen patients, they have fallen out of bed and they've busted their head. I've seen
Okay.
it. Looked like a massacre. Um, I have actually, the man that was the patient that was kicking me in the ribs, he didn't fall because I caught him, and I took an elbow to the jaw whenever I caught him, but nevertheless he didn't fall. We have got these rubber mats now that feel like ergonomic rugs,
Mm-hmm.
and you can drop an egg on it, an egg will not break.
Oh, nice.
Yes. So every patient's room has that. In addition to, we've got we've got the alarm systems on our beds that we plug into the wall,
Mm-hmm.
and then that will even ring into our system on our phones in our pocket.
Okay.
So it's not, and plus we got fall bands. We've got so many different fall risk steps to take to help prevent the falls.
Okay.
Like we went 2 months without a fall, but the one patient, he was just so fast, you couldn't get there fast enough.
Understandable.
So there's just been so many advances, and obviously we can't restrain them. You can't have 4 side rails up. That's
Mm-hmm.
illegal. That's a restraint. But you can have 3. That will buy you a little bit of time.
Because they've only got that one side, yeah.
Yeah.
So, have you ever now? I'm imagining that you're working with, like you said, mostly surgical patients and stuff like that.
I work on the step down ICU unit, so I see all of it. I see
Okay.
everything from post cabbage after they're out of the ICU, whenever they're extubated and they still got chest tubes. I see that. I see post Whipple patients.
Oh.
Once they're out of the ICU, we see a lot of AFib RVRs.
Okay.
A lot of hypertensives, a lot of pulmonary edema, a lot of we see a lot of that, and then we see a lot of diabetes.
Oh, really?
My gosh. Yes, it's insane. The people that do not take care of their blood sugars.
That's interesting to bring that up. Wow.
Yeah, they're over 600, and we have to put them on what's called an endo tool. Yeah, and it's an insulin drip, and they are sick.
Yeah. Yeah. Wow. I mean, yeah, I was going to say, like, I'd be amazed if they were even conscious at that.
Some of them are, well, I've seen one, but she's also got other underlying issues. We call that one in particular somebody who comes in often.
Mm-hmm.
And it just breaks my heart, but it's called free will. We get her, we fix her, and she goes home and comes back. But we've seen them go to ICU in near coma states because their sugars are so high.
Wow. Yeah, I guess it's just dependent upon the person, whether they're going to take care of that or not. My grandmother was a real bad diabetic, and she had a lot of problems. She took really good care of it, but I can absolutely understand seeing that all the time. So we were talking about empathy the other day in nursing, and are you seeing would you say it's kind of flatline across the board where nurses are being more empathetic, or are they getting less empathetic?
Well, this is what I'm seeing. I'm seeing a lot, because I'm old. I'm 52, and a lot of the team that I work with, they're in their early 20s. They've already got their life together.
Mm-hmm.
I could have only been so lucky to be like that, but I wasn't. I did everything the hard way. But what I am learning is these young adults are coming out of high school straight into nursing school.
Mm-hmm.
So they haven't developed that skill yet.
So it's kind of
they haven't experienced it yet.
Gotcha.
So I don't want to say it's flatline. It's just, I don't know. They haven't met it yet. Does that make sense?
No, that absolutely does. Yeah, I would imagine, empathy is something that you can either develop, or you can, you can cause it to, you can just let it fade away. I know I know nurses that are hyper clinical, and I know
Mm-hmm.
nurses that are, very empathetic. And I said, the other day, to me, more, more and more, I'm starting to see less empathy and more clinical approach to
Mm-hmm.
the patients. And that may be part of the reason why is, I'm looking at, younger people coming in, they haven't developed that yet.
Mm-hmm. I've got one kid. He's a student, and he follows me, and he's had me. I mean, he's been with me twice, and he can admit he has no empathy. He has no desire to have empathy. But his end goal after he completes his bachelor's degree in May, his end goal is to go on to be a CRNA. I said, problem solved. You don't have to have empathy.
Yeah.
You'll be asleep. He said, exactly. So he does have a goal. He's self aware, and he does have a goal in the end.
Okay.
So
Well, yeah, that's actually, when you set yourself up for something like, uh where you're not dealing with, patients who
mm-hmm.
are readily there. Yeah, like
Right.
that's a good plan if you're not that kind of a nurse.
Either that or he would be good in the ER. And from what I see, not that I've got a lot of experience, but it's definitely a different culture. It
Okay.
really is, and it's not my kind of culture. I've been down there a couple of times to do overflow patients, and not that I didn't enjoy it. I love the new atmosphere,
Mhm.
but it's not something I would want to do all the time.
Ah,
It's definitely a different culture, and I'm not saying that in a bad way. It's just different. Just like working in a nursing home is a different culture than working in a hospital setting.
absolutely.
So, but I think the ER is just a different culture, and I have mad respect, just like labor and delivery. I mad respect for them too. That's not my culture either. I don't want any part of that. So, it's knowing your niche and knowing where you're going to succeed.
Mhm.
That plays the big part where you can make the most difference. So,
Have you ever had to do any hands-on life saving before?
yes, I work in the step down unit.
That's what I was
Yes,
going with that. Can you give me
yeah,
a quick rundown on one that just had your heart pumping and stuff?
they all do. I can't know. It's all adrenaline. That's why I
Okay.
don't work that's why I don't work trauma. I don't like that adrenaline. I don't like coming down off of it.
Ah,
I
I
don't.
gotcha.
Um, it's for me. It just depends on how the scenario begins. If
Mhm.
I've had them, and all of a sudden it just happens out of nowhere, then I'm thinking, what could I have done differently to prevent this? But that's where a debriefing comes in
Mhm.
with the team and all the people that are involved. That's where that you couldn't have done anything different. It was just going to happen. Um, or if I'm walking into it and they're like, oh, and they're because what they have at the hospital,
Mhm.
they have a co-cap team. So basically, what you do is you're doing everything that you can do. You're getting everything ready. You're doing compressions. You're getting the bed flat. You're doing what you have to do until the team can get there. And
Okay.
that is what they do. And they are like a well-oiled machine. So at most, I'm just taking turns doing compressions while
Gotcha.
they've got everybody else while they've got everybody else doing their role. And it's a very, very smooth and very, very impressive, to say the least.
Absolutely. I've witnessed some things, on the outside, and I'm amazed to see you guys go into action. And
Mm-hmm.
can you give me an idea about, like, you were talking about doing compressions? What Give me a time where you had done compressions that and you were completely exhausted from it
Every time.
every time.
Yeah.
I was wondering if that was where you were going to go with that. Is it a every time thing? Because
That's why you out, because you are, and then you hurt in places you forget you have muscles.
yeah, a lot
You
of people
do.
don't really realize how much effort it takes to keep someone alive that way.
And I'm not a tall person. I'm only 5'3".
Oh, okay, okay.
So if I am compromised in my stretch and my straddle, that makes it even more difficult. There's been times I've been up in the bed.
Yep. Yep. Wow,
Because I'm
man.
sure. Mm-hmm.
Wow, that's awesome. I mean, not
Mm-hmm.
awesome, but you know what I'm saying. That's highly impressive. I love to hear when people go that that extra mile. And you're keeping someone alive. You're gonna feel that pain the next day from the exertion
Yeah.
you've put yourself through.
Mm-hmm. Yeah.
That's
You
awesome,
sure
man.
do.
All right, well,
But
go ahead.
the goal is to prevent it.
Absolutely, absolutely. Like you don't want to just throw your hands up at the end of that and be like, "Well, I'm done." It's
Yep.
awesome, man. Wow, yeah, you definitely you're a well versed nurse there, Kathy, and I absolutely appreciate the work that you do. That's anytime I'm talking to nurses, I want I want people to understand like the stuff that you guys have to deal with on a day to day basis, whether it be, keeping someone alive or, just checking them to make sure that they're comfortable, like, you guys are on the front line of that stuff. And it's, a lot of people in the world don't really realize that you guys are there doing all those things. A lot of times
Mm-hmm.
people think that, nurses are just, pencil pushers. And,
Yep.
you guys have a lot of
Yep.
hands on things to do to keep people alive.
Mm-hmm. Yep. We sure do. It's definitely a big role. It's a big role, and it's not meant for everybody. It's not.
Yeah, I'm not one of those people that would be a good nurse.
Well, what's great about nursing is there's so many different branches and avenues. There's bedside's not for everybody. I can't imagine doing anything else.
Okay.
Bedside, but there's so many different. There's nurse managers. There's case managers. There's nurse educators. There's just so many other things where you don't have to do like especially like the people that are the book smart, the clinical smart of it. That those make the best educators. And then you've got the case managers, the ones that do they're good at tasks and phone calls and organizing things and getting things set up and planning things. Those make the best case managers.
Okay.
So it takes a whole genre of people with certain skills and special skills that makes it work for the healthcare system.
I can understand that. Is there any? Well, I don't want to. I don't want to. Just like sing. I don't want to single anyone out. But are there anybody in the healthcare system that you think are just extraneous people that don't really need to be there?
Of course.
Can you give
Of
me an
course.
example of one or two of those people? Not by name, but like perhaps in title. And definitely,
um
you don't have to go into anybody that you work with in
specific. I'm not going to name names, but I'll be specific. They don't work there anymore. But you look at your assignment and who your partner is makes all the difference in the world, and that's across the board. But I know exactly what kind of day I'm going to have based on who my partner is with my patients, my tech. I know
Okay,
what kind of day I'm going to have.
okay,
Just like my techs know what kind of day they're going to have if I'm there. There's not a single tech that I work with that doesn't say yes, she's my nurse.
okay,
There's not a single. They know they don't have to struggle if they've got me as their partner, and vice versa. But I've had them few over the course of 8 years. You're going to struggle depending on who your tech is, and just
understandable.
like the techs know, they're going to be called for a glass of water based on who their nurse is. So it's
Okay.
across the board. I see it all the time.
Now, Is the techs one step underneath your CNAs, correct?
They're one and the same.
Oh,
They
okay,
are.
okay.
Yeah.
Gotcha. Gotcha. Okay. I just wanted to, clear that up, and make sure that I was, had the
They're
right
just
understanding.
yeah, they're just called techs instead of CNAs.
Okay. Okay. All right. Kathy, thanks a lot. Have a good rest of the day.
Okay, thank you.
All right. Thanks a
Bye.
lot, Kathy.